Hey, Josh.
Oh, Christian, maybe fist bump for the time being.
Wait, why is that?
Well, coronavirus.
Oh, that makes sense. Hey, on this week's Beat Blast, we're talking about COVID-19. It's the new strain of coronavirus that's spreading around the world.
And we're hopeful we can give you some tips that will help safeguard you and your family.
Or tell you what to do if you think you have it. Stick around. Welcome back to the Beat Blast, sponsored by the Admiral Theater. We're at the Kitsap Public Health District learning about the new strain of coronavirus, COVID-19.
Yes, Christian, it comes with a variety of different symptoms, including runny nose, cough, sore throat, and fever.
If you feel ill, it's best to stay home. And if you want to see a doctor, you should call ahead first.
And of course, if you got a cough, put it right into your sleeve. That way those coughlets don't get out and they could possibly transmit if you do have COVID.
Definitely, and maybe the hardest for people is staying home when they feel ill. It's very hard when you have a job and other things to stay home when you're sick. But probably the most important thing about this virus is that it is likely that most people in our community have no immunity to it at all. And so to protect each other, it's especially important with this virus to stay home when one is sick until one feels better and symptoms and fever have been gone for 24 hours, very similar to other infections that people have dealt with.
And remember, Christian, not to touch your face because that can help the spread as well.
Right, when you're washing your hands, you should wash for a full 20 seconds, wash them often, but failing that, you can use hand sanitizer.
Some thresholds perhaps for reaching out to your doctor. One threshold for that might be if you have experienced complications from influenza and other respiratory illnesses. I recommend that you reach out to your physician early to talk to them about when they want you to contact them about your symptoms. But if they're not at risk, a time to pull the trigger maybe and ask your doctor what you should do would be when this doesn't clear up after, say, 3 or 4 days, or it does clear up and then you feel worse again suddenly, or anytime you feel distress or your child feels distress. They're having difficulty breathing, they're not responding to you when you're trying to talk to them, and really this is mostly about fever and cough. There's a fever that can't be controlled. It's starting to get really scary. It doesn't pass after 3 or 4 days. And then we recommend that people reach out to their physician's office, not just with COVID, but also with influenza and other viral illnesses, so that if your doctor can provide you assistance over the phone, then there's no risk either to you or other patients in the waiting room of being around other people. And then your physician can advise you about whether you should seek care or not.
Also, you may be tempted to purchase and wear a face mask, but the World Health Organization cautions that you should only do so if you're sick or taking care of a person suspected of having COVID-19. If you're healthy, there's no need for a mask.
And last but not least, think about maybe going for a good old-fashioned elbow rather than a handshake.
That's our show for this week. Thanks to our sponsors, and a special thanks to those of you who read and subscribe to the Kitsap Sun. We couldn't do this without you, and we'll see you next week.